Welcome back. I'm Dr. Nick, and today we're going to continue our series about the most common running-related injuries. Next one up is something I'm very familiar with, plantar fasciitis, or what we now call plantar heel pain. So basically what that is exactly what it sounds like. It's pain along the inside of the heel bone. As always, don't forget to like and subscribe and share this video to someone who may need it. Now most people know this injury as plantar fasciitis, but we like to call it now plantar heel pain. Why is that? Because it's naturally not necessarily an itis. Like there's not really a ton of inflammation that's going on into that area. So we like to break it back a little bit to maybe more generalize this injury and just call it plantar heel pain. So what do we look for? Well, we're going to look for pain in the heel as soon as you get up in the morning. So those first couple steps are really uncomfortable. You're also going to see it when the longer you're on your feet. You're going to have worsening symptoms. And as always, with a lot of our running-related injuries, one of the first things we look at is, has your running volume increased a lot recently? Like I mentioned before, you're going to have clearly pain along the inside of that heel, but patients who present with this may also have a limited dorsiflexion, which means they have trouble with that contact and rolling the shin over the ankle. They're also going to look at limited big toe extension, so how much can that big toe fully extend, and you're going to see weakness in the plantar flexor, so your gastroc and your soleus. I like to look at plantar fasciitis a couple different ways. First off is, what does your shoe pattern look like? A lot of these folks are going to be, they might be caving in a little bit. There might be a little bit more wear pattern along the inside of the shoe. One of the things I like to have them do, as part of their program, is to try and walk barefoot at home as often as they can. Walking barefoot not only is going to allow those toes to breathe, but it's going to allow your plantar fascia, so the bottom part of that foot, to stretch out a little bit more and get a little bit more of that big toe extension that these individuals may be lacking. Not only is this going to stretch out that big toe, but it's also going to strengthen all the muscles in the bottom of the foot. The other thing I like to look at is, why is that area being irritated in the first place? Sometimes with plantar fasciitis, it's not a foot issue. Sometimes it's not a mechanics issue. Sometimes it's a force issue. Specifically, why is the force being transmitted to that particular area and not somewhere higher up or to a muscle group? And one of the things that I always look at is whether or not the foot is being able to move into and out of what we call pronation. People think of pronation that it's super bad, but it's necessary and it's a natural movement of the foot. Sometimes there is some conflicting evidence about overpronation, so really bringing that ankle medially towards the inside. It might increase some stress to that area, it might not. One thing that is key though is the amount of impact that's going through the foot. I don't think pronation is a bad thing. I think it's necessary. But something that may be warranted to look at is being able to control the foot into and out of pronation. If we're not able to control that motion, there's going to be more impact through that plantar fascia, and that's going to be one of the main reasons why people develop plantar heel pain. So what are we going to look at first? Well, as always, we're going to look at running volume. So maybe dumbing it down a little bit, taking off some miles, see if that changes anything. With a lot of our running-related injuries, overstriding is going to be one of the biggest causes of running-related injuries. So that's another thing we're going to be looking at, working on the cadence drills that I talked about in the previous video. So what do we do to help control that pronation? The first thing to look at are the muscles of the foot. So one of the ways to do that is then we'll start walking barefoot. There are also what we call intrinsic foot exercises that not isolate, but emphasize the inner muscles in the bottom of the foot. And you don't have to do this for a long period of time. It can be 5 minutes a day that you work on this. The easiest ones to do is called an arch lift, where basically you take the foot of your arch, you're taking your foot and you try and create a little bit more arch by squeezing your toes and keeping your heels down and back like that. Toe crunches are another big one, where you basically try and squeeze those toes under you. Also toe splays, where you try and make the foot as wide as possible. That's why I recommend walking in those barefoot shoes, to allow those feet and those toes to move a little bit more freer. Now, is this the only thing you have to do to control pronation? Absolutely not. There are a lot more muscles up the chain that need to be worked as well, specifically
glute med, glute min, vastus lateralis, so the outside of the quad. Those three are really big contributors of pronation as well. And your soleus, because like we mentioned before, we're going to see decreased plantar flexion strength, so the muscles, so your gastroc and your soleus as well. So those 5 muscle groups and the intrinsic muscles, the intrinsic foot muscles, are probably the biggest contributors to pronation, being able to control and move into and out of that movement pattern. Now, you could always do some short-term things to continue to run and continue to function. So you could change your shoes to provide a little bit more support along the inside. You could do some taping. Again, neither of those are really fixing the problem. And as always with any running-related injury, you want to be patient. You want to slowly build back up your tolerance to running while working on the things that may be weaker or you may not have complete control over at this point. So I'll post a video later this week with examples of the exercise and muscle groups that we mentioned today. So check back in for that later. And again, don't forget to like and subscribe and share the video. And I'll see you next week with the next running related injury, which was shin splints. Have a good one.